If you clicked on this video, you're probably asking, is the McKenzie method safe? And this is something that we should all be asking anytime that we're sort of investigating different clinicians or clinics or therapies. And the short answer to that is yes, the McKenzie method is very, very safe. And the reason for that is twofold. The first one is that we're going to use what we call a progression of forces. And what that means is that we're going to start on the lowest progression, the least amount of force possible, and then we're going to progress up through until we find what we would call a therapeutic dose, or the amount of force that is getting the appropriate response that we're looking for, which in your case might be get out of back pain or get your shoulder moving better, whatever. But what we do in this case is that we're going to slowly and cautiously progress you through the force progression until we find that therapeutic dose. That ensures that we're not applying more force to you, the patient, or the joint, or the tissue, or whatever, that you guys can handle. So that allows us to be very, very safe in that we can sort of meticulously and cautiously step through that progression of forces. The second one is because everything that we do here in the clinic and also in McKenzie at large is going to be based on the patient response. That's you, the patient. So we call this the dose response model. And this is an incredibly powerful model that is the foundation of everything that we do here because it allows us to be highly specific to you, the patient. What typically happens is you go to the doctor, you tell them that you hurt your knee or your back or your shoulder, they listen to your history, and then they usually will just take a picture like an x-ray or an MRI, and then they essentially just make an educated guess on what they think that you need, and then they send you away with that. What we do here is we're going to take you through a meticulous exam where we are always reevaluating how you, the patient, responded to the therapy that we applied. So that allows us to be really specific, and it allows us to be very, very safe in our progressions. So when you leave here after your exam or really any subsequent visit, we're going to have reevaluated you multiple times throughout that visit to ensure that what we're doing actually works and, most importantly, is actually safe.